This part of the lecture is going to speak about communicable diseases. I'm only going to focus on the top 3 communicable diseases: diarrhea, lower respiratory tract infection or pneumonia, HIV, TB, malaria, and neglected tropical diseases. The burden of communicable diseases is still very high. You can see in this graph from 1990 to 2017, the orange is related to communicable diseases, and you can still see we have half of the global burden of disease is related to communicable diseases. And so the burden of communicable disease is still very high. Let's look at diarrhea and lower respiratory infection. Diarrheal disease is the second leading cause of death in children under 5 years of age. It's both preventable and treatable. A significant portion of diarrheal disease can be prevented through safe drinking water and adequate sanitation and hygiene. Diarrhea is a leading cause of malnutrition in children under 5 years old. Pneumonia accounts for 16% of all deaths of children under 5. Pneumonia can be caused by viruses, bacteria, or fungi. Pneumonia can be prevented by immunization, adequate nutrition, and by addressing environmental factors. Pneumonia caused by bacteria can be treated with antibiotics, but only 1/3 of children with pneumonia receive the antibiotics that they need. Pneumonia and diarrhea together account for 29% of all child deaths globally. This is really startling. Just think about how many children that you know of living in Canada that have died from pneumonia or diarrhea. There's very few. Children just don't die of diarrhea and pneumonia, but I see so much of it on my travels to Ghana. WHO and UNICEF have partnered to develop the Global Action Plan for Pneumonia and Diarrhea. This is a really interesting plan that they've developed because they've combined diarrhea and pneumonia and tried to kill 2 birds with 1 stone. So with diarrhea, the recommendation is vitamin A supplementation, vaccination, ensuring safe water and improved sanitation, and low osmolarity oral rehydration solution. So this containing zinc. And this is a solution made of salt and water that we bring to Ghana in little envelopes that cost pennies to manufacture by pharmaceutical companies, but there's just no access of this oral rehydration solution in these really remote communities. And so the number of children we see with dehydration related to diarrhea is unbelievable. And so we've actually taught mothers how to make their own ORS solution. And the number of children that are able to survive a bout of diarrhea has actually gone up. Pneumonia, on the other hand, again, it's a vaccination. Reducing household air pollution. There's a lot of cooking indoors, so doing a lot of health teaching about cooking outdoors. Ensuring that children have access to antibiotics for pneumonia, and then oxygen therapy where indicated. And so if you combine these two, you can see the overlap here of protect, prevent, and treat. So encouraging mothers to breastfeed until 6 months of age and having complementary feeding after 6 months of age is really important to prevent diarrhea and pneumonia. Prevention through vaccination, hand washing, and then treatment, as I've already discussed. This is a really interesting jacket by an inventor in Uganda who was looking to end scores of missed pneumonia diagnoses. And so it's a jacket that can diagnose pneumonia using Bluetooth. It reads temperature, lung condition, and heart rates. And it's hoped that it will decrease the number of missed pneumonias in years to come. Let's talk about HIV AIDS. So the latest facts is that there are 47% new HIV infections, which has decreased, and 1/3 of HIV is related to deaths. And so these both have decreased. And so this achievement was the result of great efforts by national and global HIV programs. But there's a little bit of a discrepancy here. You can see that 36.7 million people are living with HIV at the end of 2016. That's because of good management, they're not dying. But of that 36.7 million, only 19.5 are receiving antiretroviral therapy globally. And so this has been a huge push to make sure that these medicines are available to everyone in the world. Mother to child transmission is about 7 out of 10 pregnant women are living with HIV, and only 7 out of 10 women have received antiretroviral therapy treatment, which is low. So we know there's no cure or vaccine for HIV, although we are working on a vaccine. We do have very effective antiretroviral therapy drugs, which can control the virus and help prevent transmission so that people living with HIV and those at substantial risk can enjoy healthy, long, and protective lives. PrEP has also come on the market, pre-exposure prophylaxis. It's an HIV prevention method in which people who don't have HIV take the medication to reduce their risk of getting HIV if they are exposed to the virus. And so PrEP can stop HIV from taking hold and spreading throughout your body. It's prescribed to HIV negative adults and adolescents who are at high risk of getting HIV through sex or injection drug use. There's a big push to know your status. It's estimated that currently only 70% of people with HIV know their status. There's an HIV self-test that's come on the market. So the UN has set targets to diagnose 90% of all people living with HIV by 2020. And so, as I said in the previous slide, only 70% of people living with HIV know their status. And so, in order to fill in the gaps, countries are looking for ways to increase the access to and use of HIV testing services. And this was one way, is to be able to have individuals be able to do an HIV self-test in the comfort of their own home and interpret the results in private. Canada and HIV. Canada has all the tools to potentially eradicate HIV AIDS, but infection rates aren't coming down. And we're going to watch this short video on all about HIV in Canada.
Canada has all the tools to potentially eradicate HIV/AIDS, and yet infection rates aren't coming down. Up to 3,000 people in Canada are infected every year, year after year. That's about one new infection every 3 hours. So why does the number of people with HIV in Canada keep growing? For one, drug treatments mean people with HIV are living longer. Health Canada recently approved generic versions of a once-a-day pill that can be used to effectively treat HIV. These antiretrovirals are so effective, HIV-positive people are less likely to infect others. They can also be used to protect people who don't even have HIV if they take the medication preventatively. And while that's a breakthrough, it could also mean people aren't as afraid of getting HIV, and that could be affecting condom use. And public health officials acknowledge it's unrealistic for sexually active people to always use them. Then there's detection. At the end of 2014, an estimated 75,000 Canadians were living with HIV. But 1 in 5 doesn't even know they have it. And public health officials warn stigma is still deterring people from getting tested. The groups most at risk of contracting HIV are men who have sex with men, injection drug users, people coming from countries with high rates of infection, and Indigenous communities. One region in Saskatchewan has the highest rate of HIV infection in the country, triple the national average. Doctors there call it a public health emergency. So what can be done? Experts we spoke to say more education and harm reduction programs like supervised injection sites would help. Also, early testing and treatment with antiretrovirals. Activists and their allies in the medical community are pushing all provincial governments to make antiretrovirals available for free, for prevention. They argue it makes more sense to prevent someone from getting infected rather than waiting until they're sick. Want to learn more about HIV in Canada? Check out our sources in the description.
So a little bit of food for thought about HIV and Canada. So thinking about having antiretroviral therapies more prevalent or sort of readily available, and also the use of IV drug clinics where people can come into safe injection sites and be able to use, if you're an IV drug user, to be able to use an IV drug in a safe spot. So the UN AIDS is looking at this 90-90-90 initiative where 90% of all people living with HIV will know their HIV status, 90% will receive antiretroviral therapy, and 90% of people receiving antiretroviral therapy will have viral suppression. Another great piece about trying to decrease the number of progression of HIV to AIDS is that Africa is now getting state-of-the-art HIV drugs for $75 a year. And we talked about the TRIPS agreement in a previous lecture, and this is one piece of it, looking at breaking those patents on drugs to make those drugs readily available to communities that need them. So to recap on the HIV strategies, we're working on a vaccine. It's important to know your status. Remember the UN 90-90-90 to make sure people are tested, that they're on antiretroviral therapy, and that you have viral suppression. The action against drug resistance we'll talk about, and the task shifting of HIV management to nurses we will also discuss in the next module. And the low cost for HIV drugs is very important in our low middle income countries. So let's stop here. In the next lecture, we'll discuss tuberculosis, malaria, and neglected tropical diseases.